So as any disease, airway disease, asthma may also have long-term complications. The most common, if asthma is not properly treated or ill-treated, or if patient doesn't follow proper guidelines, then it will become chronic asthma, and the airway which we have described as recurrent variability, they become as persistent airflow limitation might be there. In such cases, patient needs to use these inhalers throughout their life. The next thing, asthma patients are more prone to develop other respiratory infections such as pneumonia and viral infections. Sometimes, if asthma may also be life-threatening, when it is called status asthmaticus. In such cases, there might also be requirement of support of ventilator. Other cases include this may lead to severe coughing. Nocturnal coughing may lead to vomitings, gastroesophageal reflux disease, recurrent sinusitis, sometimes subconjunctival hemorrhage, intracranial bleed. Everything is possible. There are also instances where a poorly treated asthma which were complicated by development of pneumothorax or air in the chest between lungs and the chest wall. As we have discussed earlier, there is nothing to prevent because it is the genetic makeup or the airway itself is made up. So hypersensitivity cannot be removed. The thing is, once a patient or a person finds it that he is developing asthma or symptoms because of an exposure to something, it's better to avoid those things. This prevents most of the asthma exacerbations. Change in climate is most commonly triggers, and most of the asthmatic symptoms occurs in night or early mornings. So if a patient develops those symptoms, it's better to take immediate inhaler therapy. So what about the genetics? As I told earlier, allergic type of asthma may have genetic predisposition. So asthma usually runs in the families. That means a person who is asthmatic may have his progeny also develop asthma, but it does not necessarily that every asthmatic patient will have a family history.